Good morning, everyone, and welcome to the Pharmacy Guild Student Summit. I'd firstly like to welcome our sponsors and thank them for their support today. We have major sponsor EBOS, who is Symbion and ProPharma, and also our foundation sponsors PDL and Gold Cross. And I'd like to also welcome Trent Twomey to present an opening address for us this morning. So straight over to you, Trent. Thank you.
Thanks, Mel. Welcome, everybody. Just so you all know, I'm in Cairns in far north Queensland, and I've got an 8-year-old and 9-year-old walking around. It's a student-free day here today, so I expect them to be as disruptive as they possibly can because I've asked them to be quiet and stay in their rooms. So I think they'll do everything except what they're asked. Welcome to the Student Summit, and I know it's been an exceptionally disruptive year, and we were hoping to do this in person at Pharmacy Connect in Sydney, but alas, Delta is disrupting everything we do, and so I'm really glad that the NAPSA management team, together with Mel in my office, has been able to put together this event virtually, because I think it is extremely important to to connect with students. And I'm sure you're all aware, but not only am I, but my wife also. We are both past national presidents of NAPSA, and so this is something that we both hold very dear. So community pharmacy. 2/3 of all of you, so 66%, just shy of 2/3, will all work in the community pharmacy sector. And I think it is the premier option for all of you to choose. And I'm going to go through today some of the really exciting changes that the Guild has been advocating for, both with the Commonwealth Government and of course with state and territory governments, which are going to come to fruition over the next 5 years, that are going to fundamentally change the way we practice community pharmacy. So we don't just maintain our position as one of the most trusted providers of primary health care, one of the most accessible providers of primary health care, but rather than being able to greet and triage and then refer, you'll be able to greet and triage and solve the problems that people are presenting to you. But I will talk more about that later. So who is the Pharmacy Guild of Australia? Well, the Pharmacy Guild of Australia is the peak body for pharmacy in Australia. We are the largest organisation in the community pharmacy profession. We're the second oldest. Our cousins over at Pharmaceutical Defence Limited are the oldest organisation, and but we work very, very closely with all of them. So it says 5,800 community pharmacies. That's ticked up a little. So there are 5,900 community pharmacies around Australia. And as I said in my introductory remarks, we are the most accessible form of or component of the primary healthcare infrastructure in Australia. So 97–98% of all Australians live within 2.5 kilometres of their local community pharmacy, and there are 400 regional, rural and remote towns around Australia that have a community pharmacy but don't have a general practice. So not only are we accessible during those times of day and days of week where general practices are closed in major metropolitan areas, but more often than not, we're the only piece of primary healthcare infrastructure in a lot of regional Australia. So we represent over 80% of the community pharmacy network, and that is climbing. I'm pleased to say we have our highest membership to date as of the 31st of August since 2017. So the Guild, its membership is increasing month on month and year on year, and I'm very proud of that. There's a great team at the Guild, a great culture at the Guild, and I think that is a show-tell sign that we really are not just recognised as the body that is advocating on behalf of the profession, but we're providing real tangible benefits to those people at the coalface as well. We dispense over 300 million prescriptions a year, but more than that, we provide over 450 million occasions of service a year. So as I said before, we're more than just dispensing prescriptions, and I'm going to talk about that in a moment and how that is playing an even greater role. But 450 million occasion of service, 150 million things we do have nothing to do with dispensing a prescription. So the 4 focus areas, obviously, member services and engagement, advocacy, community pharmacy sustainability, and of course, governance and enabling functions just to run the big beast that is the Pharmacy Guild of Australia. One point I get a lot of questions from young pharmacists and pharmacy students about is wages, and I'm more than happy to talk about that. So I'll address that up front. The Guild loves data. I personally love data. It's the only thing that differentiates people's opinions from fact. And the simple fact of the matter is that wages run in complete parallel to the profitability of the sector. We can track this longitudinally over the past 20 years, but the more profitable a community pharmacy is, the higher employees' wages are, and that is a fact. So cuts to community pharmacy from the Commonwealth Government have resulted in lower wages. So I'm really proud of the 7th Community Pharmacy Agreement, the one that renegotiated, because remuneration at the end of the agreement per pharmacy, per prescription will be higher than at the beginning. And I have no doubt that that will flow through to pharmacy wages as it has in the past. So the COVID-19 vaccination rollout, it would be completely remiss of me if I did a presentation today and didn't talk about the elephant in the room, which is COVID-19. But where we stand today, as I said, there are 5,900 pharmacies, and about 3,000 community pharmacies are participating in providing COVID-19 vaccinations to their community. So half of community pharmacies are participating in this program. And considering this was something that did not exist 3 months ago, last quarter, not last year, not last decade, this didn't exist 3 months ago, to take the community pharmacy profession on this change management journey in a matter of weeks is just a phenomenal task. And if it wasn't for people like Mel in our National Secretariat, and of course all of her colleagues, Erica and Philip, and our Chief Pharmacist, Chris Flood, we wouldn't be able to not only get the policy and the advocacy instruments right, but we wouldn't be able to get the training rolled out, the IT programs rolled out, and all of the change management that's required to roll out a new service. So as of the 2nd of September, we delivered around 350,000 vaccinations, COVID-19 AstraZeneca vaccinations. As you can see, those states that are in lockdown, so New South Wales, you get the highest number of not just pharmacies participating, but you're also getting the highest number of vaccinations being administered. Queensland is just ahead of Victoria, but that's because we had a head start, right? We started back in June, and Victoria really only started in earnest 2 weeks ago, but they will definitely overtake Queensland very, very shortly. Engagement with stakeholders. So I have a fortnightly webinar that I run as the National President of the Pharmacy Guild that is open to the entire profession. So whether you're a guild member or not, whether you're a pharmacist, a pharmacy student, or a pharmacy student, it's free for all of you. And these are the guest speakers that I've had in recent fortnightlies. We've had the Honourable Greg Hunt, the Federal Minister for Health. We've had Lieutenant General John Fruin, who is the head of the COVID-19 Vaccination Task Force. We had the Prime Minister last week. We have the Leader of the Opposition next week. No other organisation in the pharmacy profession gets this level of access and is able to have frank, honest and open conversations with these people in interactive forums like we're having right now. So no other organisation has this access, and it is the Guild's not responsibility to ensure that we use these relationships, we use this level of access to get the change that is needed to not only increase health outcomes for our patients, to decrease the gap in health outcomes between Indigenous and non-Indigenous Australians, but also to drive the profession forward. And we take that level of responsibility exceptionally seriously. And it's my absolute pleasure to be the custodian of the office I hold for however long my council chooses to allow me to do my role. Something that the Guild is launching next week is a specific community pharmacy Arm Yourself public relations campaign. So it is a multi-million-dollar campaign. It will be the largest consumer-facing, public-facing campaign in the history of the pharmacy profession in the country. And what it will do is it will not only obviously drive the uptake of COVID-19 vaccinations through the pharmacy network, but it will have a lasting legacy. It will increase trust. It will increase the acknowledgement that we're more than just dispensing prescriptions. It will create an online community that we will be able to leverage long after the COVID-19 vaccination rollout hits the 80% target, to be able to promote pharmacy as that primary healthcare hub, to be able to deliver all of the great services that you are all trained to do. And I can't wait to have you part of the profession delivering all of those services. So as I said, the Guild's a big beast, and we have many different arms and many different tentacles. And one of the great things that we've invested in on behalf of the profession, at great financial loss to the members of the Guild, but nonetheless of great professional benefit to all of you, is being able to create the digital assets to be able to ensure that community pharmacy goes from being that island, that standalone piece of health infrastructure, to a truly integrated piece of the primary healthcare system in Australia. And when I mean integrated with the patients. Patient-controlled My Health records, integrated with state and territory governments for the purposes of real-time prescription monitoring, for drugs of abuse and drugs of dependence, for the integration with state authorities for the purposes of preventing illicit drug deferrals, such as Project Stop, and of course integration with the Commonwealth Government through things like the Australian Immunisation Register. Those integrations are two ways. It's not just for us to send the stuff up to the cloud that we do. It's also for us to draw down those pieces of information so you can access them in a really easy way in your dispensaries, so you can make informed clinical decisions for your patients. So as I said before, the Guild doesn't just advocate with the politicians. What we need to do is we need to work with the bureaucrats at all levels of government to ensure that we integrate the community pharmacy profession so we can truly step up to the plate and play that later expended role. But those 3,000 pharmacies that I spoke about are now all available in a geospatial form on the findaPharmacy.com.au website. You can use your mobile phone, and if you have your locations turned on, you can say, send me to the closest location to get a COVID vaccine. Send me to the closest location to receive my prescription filled. Send me to the closest location to receive a flu vax. So this very powerful tool is receiving about 1.1 to 1.3 million individual consumer hits a week. So of all of the assets, not just in the Guild family, but in the entire profession, this is the most consumer-facing public portal the profession has. It's all about partnerships. And though the Guild takes its responsibility to be the leader exceptionally seriously, it's not all about us, it's all about you. We have a rule at the Guild. We are strongest when we are talking about our patients, and we are strongest when we are talking about the profession rather than ourselves. So you will never see me talk about what the Guild wants and what I want. It is always about what is in the best interest of Australians, what is in the best interest of Victorians, New South Welshmen, Queenslanders, what is in the best interest of pharmacists, pharmacy assistants, and of course pharmacy students. This is an initiative on the screen before you that the Guild put together with PDL. PDL, as I said, is the oldest body in the Australian profession. It is the body that provides professional indemnity insurance for all of you. They are a great friend of the Pharmacy Guild. We're a great friend of theirs, and they're a great asset to all of you. We've also got the Australasian College of Pharmacy, something my wife and I not only had the pleasure of being your national president for a period of time many decades ago, but we also both at one stage or another had the pleasure of being the president of the Australasian College of Pharmacy. And this network between PDL, the college, and the Guild has formed an invaluable triage, or triad, I should say, if I want to use a funnier term, to be able to present uniformed positions to the Commonwealth of Australia, to be able to produce flyers and assets like the one before you, which are a simple leave behind for those people that have opted to get a COVID-19 vaccine through pharmacy of common side effects they may feel, and what to do if they feel any of those particular side effects. Some of the other great things that we've been able to do, and all of this stuff is for free. It's available not only to all pharmacists and pharmacy assistants, but to pharmacy students as well. So go to acp.edu.au. You can join the college as a student for free. I encourage you to share that with all of your friends as well. But there are some great resources in there. The A to Z of AstraZeneca, which is just some FAQs, and there's also some great practical videos on motivational interviewing for people that may be hesitant, and there's also a great FAQ in there with a infectious disease specialist from Queensland, from, I believe he's at the Mater. But my baby, what do I want my presidency of the Guild to be classified by? And of course, you know, as I said, I'm just the custodianship of this wonderful office that's leading this great organisation. But if I fast forward to the end of my tenure, however long that may be, I want to bequeath to all of you a stronger profession than what was bequeathed to me. And by a stronger profession, I don't just mean a more respected, a more highly paid, a more empowered, but I want to see a profession that is practicing to its full scope of practice, utilising all of the skills and knowledge that you have been given at university to step up to the plate and be that true primary healthcare professional. But the biggest barrier to that is not money, it's not regulation. The biggest barrier to that is actually all of you being brave enough to embrace all of these new initiatives. And I'm going to talk about a few of those now. So what is full scope of practice? Professor Ross Suzuki from Alberta, he's at the medical school over there. He's a pharmacist. He's an absolute guru. He's the god internationally of full scope of practice. And in fact, he was the keynote speaker at the Guild's Western Australia Forum only last week. So there's a great little picture there that describes it visually. But for all intents and purposes, pharmacist has, as I said before, all of the skills and knowledge necessary to perform these following three tasks. That is to prescribe, to dispense, to administer, and to review. All of you have the ability to do those four things, but unfortunately there exists red tape and barriers, both at state and territory levels, but also at a Commonwealth level, that prevent you from doing all four of these things. And that's what the Guild is advocating for right now. We're advocating to rip down the barriers, remove the red tape, so you can not just dispense everything and review everything, but you can also prescribe everything and administer everything. So all drugs, all patients, all disease states. And when we can remove those barriers and you can fully do all of these specific tasks, that is when you will be able to satisfy the role of being a community pharmacist, which means you'll be able to provide treatment for not just vaccine preventable diseases. You'll be able to provide treatment for acute occasions of service like urinary tract infections, but you'll also be able to manage chronic disease, so diabetes, cardiovascular disease, even mental health. But we need to remove all of the barriers, so when people present to you in pharmacy, you don't just triage and refer, but you can triage and treat. And that means that we will be able to utilize all of the technology, all of the skills, all of the level of accessibility that we already have to be able to provide better health outcomes due to better access. So as I said, well, actually I didn't say, I'm only the 9th national president of the Pharmacy Guild of Australia, number 9, and nearly our 100-year very strong history. So the Guild has 3 important documents at the moment, and these were approved by our National Council in May of this year. The 3 documents, one focuses on the union, that is our strategic plan. One focuses on the pharmacy, so the network, and that is the framework for change that you see before you. And the third and final one is the full scope of practice document, which focuses on the practitioner. So 3 documents which must be read together. And one is about the organisation, one is about the bricks and mortar network, and one is about the individual practitioner. And they outline what success looks like for those 3 areas as we move towards the Guild Centenary in 2028. And to be able to achieve all of those things that I've been speaking about, we need to be able to action specifically the roadmap as outlined in these 3 particular projects. The 7th Community Pharmacy Agreement, there's my predecessor, George Tambassis, in the front with Greg Hunt signing the 7th Community Pharmacy Agreement. In the back row is our long-suffering Executive Director, Suzanne Greenwood. She runs interference for me on many a thing. Of course, we have the Prime Minister of Australia. We have myself. I was the Senior Vice President of the Guild and the Chief Negotiator at the time. And then we have the Deputy Prime Minister, the Honourable Michael McCormack. But there is your Guild, there is your profession signing the genesis of the roadmap, which will shape the way in which the community pharmacy profession is viewed by Australians, but also the framework in which we will be delivering services to achieve all of those things that we're speaking about today. That was the 2nd agreement I was involved in. I was a junior in the 6th one. And Mr. Anthony Tassoni, who's my who's my Vice President for Health Economics and Policy, and he's our Victorian Guild President. He's taken over that role, and he will be our Chief Negotiator for the 8th agreement, and he's doing a marvellous job, I have to say, to date. One of the specific clauses in the agreement, clause 12.4, which is the responsibility of the Guild and the Commonwealth exclusively, as written in the agreement, is called a Doctor of Pharmacy. This clause was co-crafted with the Guild negotiating team together with CPS. Now, CPS is the Committee of Pharmacy Schools, and it comprises of all of the deans, the heads of program for all pharmacy schools in Australia and New Zealand. I'm just going to read this out for a moment and I'll explain what the significance is. The signatories the Guild and the government, agreed to take all reasonable steps available to them to enable the holder of an Australian Qualifications Framework Level 9 Master's degree extended in pharmacy to be treated by exemption as a Level 10 qualification, similar to treatment of other health professionals covered under the National Registration Accreditation Scheme. So what does all that jargon mean? Well, it currently takes 5 years to train a pharmacist in Australia, 4 years of a university degree, plus a year of experiential placement called the intern training program. So what this clause does, it commits CPS together with the Guild and the Commonwealth to reframe the way we package that 5-year training program from a 4-year degree plus a year of experiential placement to a 5-year integrated degree. So it currently takes 5 years to train a pharmacist, and it will still take 5 years to train a pharmacist. But what this does is it properly reflects the body of work that already exists. Okay, so you're already doing the level of work, which in many cases already encompasses research. The most prevalent degree structure in Australia at the moment is a B.Pharm Hons. Most programs in Australia, over half of them, are a B.Pharm Hons. The remaining 45% or so are a mixture of Masters, Masters Extended, and the traditional 4-year Bachelor. So we're already seeing an evolution of this. In fact, many universities already provide the intern training program. The Guild is also one of those providers. So this will see the Guild exit as a provider of the intern training program, and we will cede this responsibility to the universities. Graduates of this degree will be able to fully autonomously prescribe. They will be able to dispense, prescribe, administer, and review all medications for all patients. They will be full scope of practice pharmacists. So the Guild's responsibility will be not only to play in the space of continuing professional development to ensure that over the course of your degree you remain relevant and fit for purpose, but our job and our attention will focus from running the intern program to retrofitting the existing workforce. So there are 35,000 pharmacists, as I said, 66% of those are already practicing in community pharmacy. So we need to upskill people like me to be able to do all of those new whiz-bang things that those new graduates will be doing. Many of you that I'm speaking to here today won't graduate with this degree. So guess what? You'll be just like me. So you will have to do whatever the retrofitting is that we are currently co-designing with state and territory governments. Graduates of this new program will be able to use the title doctor. So if Mel Sykes-Briggs was a graduate of this, she would be Dr. Mel. And this is just bringing us into line with what other OECD highly developed countries are already doing. So not only will this deliver real tangible benefits to Australians by being able to access full scope of practice services from their pharmacy, it will help bring back the prestige, the power, and the nobility of the community pharmacy profession that, to be frank, I think has lost a bit of its shine over the past many decades. The last thing that it will be able to do is increase workforce mobility. It will be able to say to those jurisdictions like Canada, like the United Kingdom, that are already 10 years ahead of us in full scope of practice, those workforces will be able to be acknowledged for practice in Australia, and you will be able to be acknowledged for practice over there. Something that we've lost that I definitely want to bring back. It needs to be reciprocity of qualification acknowledgement with other highly developed countries. So community pharmacy programs. This is the list of pharmacy programs that are funded under that 7th agreement. But Anthony, as I said before, my Vice President for Health Economics and Policy, is busily renegotiating these, redesigning these programs to ensure that whilst they have done marvellous things to be able to increase access to medication services to patients to date, they are not fit for purpose in being able to fit in with the architecture that we were just describing before. The occasions of we have the dispensing fee and the administration and handling and infrastructure fee to pay for dispensing, but we don't have a payment structure to pay for prescribing, to pay for administration, and we do have a payment structure to pay for review. So those 4 things, prescribing, dispensing, administering, and reviewing, we need a payment structure to ensure that there are no out-of-pocket expenses for consumers that can't afford it, because access is defined not just by being 2.5 kilometres to a pharmacist, it's being able to have the funds to access that professional service. And under Australia's universal healthcare scheme, your capacity to pay should not be a barrier for you to access any of these essential services. So redesigning these programs, we're leaving the dispensing fees over there to fully pay for dispensing, but these programs need to be redesigned so they have the flexibility not just to provide occasions of service for review, but occasions of service that may involve prescribing or occasions of service that may involve administration, aka vaccinations. Neuro-enhanced community pharmacy initiatives. There are many things that are happening. E-health initiatives, as I said, I alluded to those before, integration with things like the Australian Immunisation Register and the patient's My Health record. These things are clunky when we first roll them out. They can be a bit of a nuisance and an extra workflow burden to pharmacists having to do them, but the Guild is investing heavily in those IT companies that we own to smooth that out, reduce the number of clicks and alt tabs that you have to do to really build those things in an IT aspect to make it more seamless as you are dispensing. So this isn't extra things you do on top of dispensing. It should be part of that dispensing continuum. And so doing new things not only requires sometimes new training, but it also requires changes to workflow. Affordable medicines reform. 1 in 5 Australians can't afford their medicines. 1 in 5. That's disgusting. If we can afford the Olympics in Queensland, we can afford to make sure that 20% of Australians can afford to get their essential medications. Because as you know, if you go without your medicines, you end up in hospital. It's one of the top 10 potentially preventable hospital presentations in Australia, and that is something that lowering the out-of-pocket expenses for consumers is something that the Guild is focused on. Mental health initiatives and aged care, I could have an entire presentation on in and of itself, so we'll leave those two for another day. I just want to give a bit of a shout out to the Guild's Early Career Pharmacist Resource Hub. It's down the bottom there, guild.org.au/ECP. Always hate that acronym. It feels like the emergency contraceptive pill, but I'm led to believe it stands for Early Career Pharmacists. Go to that hub. It's free, it's accessible, and you can access podcasts and mentoring programs. So you can link up with some of my national counsellors that are in the states and territories that you are going to be practicing in, so you can be involved in this change management and this next journey and evolution of our profession. Guild Ed, as I said, Guild Ed's the division of the Guild that's working with our cousins over at the Australasian College of Pharmacy to provide all of these upskilling things that are going to be needed to practice to full scope of practice. Please join us. We'd love to have you. The Guild is a very broad family. We're a very broad church. Long may we be so, and broader may we grow. I would love to have you. So please, if you're going to do one thing today, pop on, not just to the college, but please pop on to the Guild and join as a free student member, so we can talk to you and you can talk to us, and you can be part of this conversation ongoing. I also want you to work for us. I want you to be brave. I want you to make a difference to communities that need it. And the best way that you can have a professionally satisfying career, the best way you can make a difference to health outcomes for those Australians that need it, is to choose community pharmacy. If I had my way, I would choose it all over again. It is a great profession. Our best years are ahead of us. And I only encourage you to hop onto the Google Play or the Apple Store and download the My Career Pharmacy app. And there's also a website there for you as well. We need you. The Guild has the youngest membership it has ever had. The average age of a pharmacy guild member is in their late 30s, which is smack bang where I am. I'm 39, so I'm the youngest guild national president in our nearly 100 years, and I'm smack bang in the middle of the bell curve of what a community pharmacy owner looks like. 2/3 of graduates are female, and only a third of pharmacy guild members are female, but that is changing. We have a higher percentage of female owners under the age of 39 than we have above 39. As I said, I work full-time for the Pharmacy Guild of Australia. My wife, she runs our group. She runs our 250 staff. She runs our 10 pharmacies, and she's doing a much better job, I could say, at it than I would do. If you want to move to far north Queensland, Georgina and I would love to have you. But the way that you can get involved in shaping the profession is to take that first important step, and that's get involved with the Pharmacy Guild of Australia. So things you need to know to be work ready. Graduating and becoming registered through your ITP is just the very beginning. You need to remain up to date. You've all heard the adages of lifelong learning and education is for life, and I can assure you that is exceptionally true. And this is just something you need to have embedded, not just making sure that as we get to the 30th of September each year, you smash your CPD to satisfy those requirements of the board, but it should be stuff that you do a little bit every week. To make sure that you just stay on top of it. And we have all of these easy turnkey things that you can do, whether it's our trade journal, ITK, that you can just leave on the smoker bench in pharmacies and have a bit of a read when you're having your cup of coffee, because I can assure you, you won't get lunch. Or whether it's jumping onto one of those podcasts that we were referring to before, or we have our fortnightly webinars, just like I'm talking to all of you now. But just make sure that, as I said, get a mentor, embrace CPD as just part of what you do, and do a little bit each week. It makes it a hell of a lot easier. Thank you. I've got a massive soft spot for NAPSA. I know that we're going to have some more interactive time together this afternoon talking about the future of NAPSA and some reform that I think that you would benefit from. And I've had a read of your constitution. Mel sent it to me, so I spent last night going through it. But if you want to communicate direct with me, you can. There's my email. You can go to my Facebook page, the Office of the Guild National President, like that, and send me LinkedIn messages, text messages, or WhatsApp messages, whatever platform it is that you use. You'll find I'm on, and I'm pretty available to answer any of the questions that you've got. So Mel, thank you very much for having me, and I'll hand back to you.
Thanks so much, Trent. And we don't have any questions. It's probably a little bit too early for most people to ask questions this morning, but thank you very much for that presentation. It was detailed, and apologise for my background, which is my bedroom. Given that we're all in lockdown and children running around and screaming, I can commiserate with you, Trent.
All of the things to look forward to, NAPSA guys.
Yeah. Take your time. Don't have kids now. All right, well, we'll sign off there. And also come back on for the next session, which is all around community pharmacy career pathways. And we have some experts who are in that field that will be able to tell you about their experiences and what they did, and the steps that they took, including getting a mentor and buddying up with people. So thanks everybody for attending, and we'll see you at the next session.
Thanks everyone. Take care.